start off, and you will be live any second now. You're live now, Councillor Sane, if you want to start off the meeting.
Right, thank you everybody, and good evening for everybody for coming and attending. I'm Councillor Shabrana Hussain. I'll be chairing the meeting today. Councillor Zohar Malik, do you want to introduce yourself?
Yeah, good evening everybody. My name is Councillor Zohar Malik of Balsall Heath West Ward. But this is a joint meeting, so.
Right. Thank you. Can I just kindly ask everybody who is watching if there was just to put their name and what ward they are in the live Q&A question, so at least I have an idea who is actually attending, because I can't see who's actually attended. Thank you. Item 2 is notice of recording. The chair of the meeting is to advise that residents listening participating in the online meeting that a recording of the meeting will be available for future record. And then we've got, obviously it's COVID, so we're going to introduce Rachel from Public Health. So Rachel, over to you. Rachel, you need to take your...
Sorry, I can't believe I still do that. Thank you, Councillor. Are you all right if I talk for sort of 15 minutes or so? Is that all right to give you an overview and then answer any questions?
That's fine.
Great,
Yep.
Thank you. So in terms of COVID, as you know, this virus appeared last December. So in terms of infectious diseases, is still a relatively, well, a very new disease. Whilst it feels it's all we've sort of thought and talked about for the last few months, it is still very new and we're still learning lots about it. We know it's part of a family, ranging from the common cold to much more serious illnesses, and this is a new strain of the virus within that family. It's spread through droplets, and I'll pick that up in a little bit in terms of the advice for people to reduce the spread of COVID. It hit us in Birmingham early March in the year. We had the first peak in April, then the numbers reduced, and back in the summer our numbers were quite low, but it's worth noting we weren't doing the same amount of testing that we are doing now. Our numbers started to creep up around July time. We entered enhanced support, then national intervention, then tier 2. All of these are terms that we keep hearing. And now with the rest of the country, we're in the second lockdown until early December. The reason for pushing us into a national lockdown is because of some results of one of the studies that's going on, which it's showing that infections have been rising across all age groups and all regions in England, with the biggest increase in those aged 55 to 64. And this is what drove the latest government decision to put us into lockdown. If we look in terms of Birmingham, the pattern of cases in Birmingham, our current rates are at around 338 per 100,000 people. Last week the figure was 287, so you can see we are still seeing a week-on-week rise, and we also have quite a high percentage of people who test positive. Last week it was about nearly 15% of those who were testing positive. Now, what I would say is, in terms of the cases in Birmingham, what we've seen over the last several weeks is that we're getting a steady rise. The rate each week is just creeping up. This is unlike some of the other areas, particularly in the northwest. You'll remember a few weeks ago, Liverpool, the case rate absolutely rocketed. Similarly in Manchester. We've seen this very slow and steady increase, which we think is down to the hard work that everybody is already doing to try and stop the spread. But clearly, we need to do more if we can. In terms of the data for the last week, we've got other areas of the West Midlands are also high. So Stoke, Dudley, Sandwell, Staffordshire and Walsall. But overall, we're seeing the highest rates in the northwest. So Oldham and Blackburn and Darwin have both got rates over 700 per 100,000. So in terms of rankings, Birmingham is now the 44th highest local authority in England, and I think we're the 7th in terms of the West Midlands. What we're seeing from all of the data is that COVID is spreading mostly through social interactions. So just the sort of day-to-day social contacts that we have with each other, rather than through just specific situations in certain settings. We think it's just through general social interactions. Our highest rates are in the 30 to 60-year-old age groups, but we are seeing a very worrying increase in case rates in the over 60s, particularly in the over 70s as well. And this is where people are much more likely to have a serious disease as a result of COVID. And this is obviously where we very sadly see the most deaths. We are seeing increases in cases in all ethnic groups, but consistently over the last few months, we've had higher cases relatively in our Asian populations, which is something that we are constantly looking at. We are across the West Midlands seeing starting to see an increase in the number of cases in hospital, and very sadly and worryingly an increase in the number of deaths. Compared to the first peak, we have got more effective treatments this time round. So people are, if they end up in hospital, tend to be staying there longer, but then this has an impact on the rest of the system as well. So in terms of sort of ambulances and getting other people into hospital. Now I do have, if you just bear with me while I just check my notes, I've got the data for your 2 wards for the last week. So in terms of Balsall Heath West, your number of cases and the rates in the ward are relatively low, so actually lower than Birmingham when we look at it as a whole. So that the rates for the last week were 204 per 100,000 compared to Birmingham at 338 when we look at the whole of Birmingham. Nearly half of your cases were in the 20 to 39-year-old age group and around 60% in Asian populations. In terms of Sparkbrook and Balsall Heath East, we are seeing much higher numbers. Now I recognise it's a large ward, so we would expect to see higher numbers. When we look at the rates, your rates overall are just above the Birmingham average. So last week they were at 379 per 100,000 and Birmingham was 338. So just higher than the average, and actually 22nd in terms of our 69 wards. Again, a very similar pattern, about half of your cases in the 20 to 39-year-old age group and nearly 3/4 in Asian populations. So we think these patterns are partly reflecting the makeup of the ward, but I'm sort of very interested in the differences between the two in terms of the COVID rates. In terms of the national lockdown, we're now more than a week into it, and I think we're probably starting to get used to the new rules. It's obviously not quite the same as last time in that the schools are still open and more people are continuing to go to work. Obviously, the advice is if you can work from home, then do so. But certainly I've noticed when I've had to go out that the roads are a lot busier than last time around. It's still very much only contact with your household or your bubble, and indoors you should only be mixing with your household or bubble. Outdoors, one person is allowed to meet one other person in a public place, and it's really important that they still maintain that social distancing, so the 2 meters social distancing. But other than going out for exercise, or if it's for work or for school, we shouldn't really be out of our house unless it's for very specific purposes which are set out in the guidance, which it's essential shopping, any health appointments, and a few other things that are set out. But as the whole, a lot of the areas where we'd have social contact are those areas that have been closed down. So non-essential retail, any leisure facilities, entertainment venues, hairdressing salons, all sorts of areas like that. And then, of course, hospitality, to try and reduce that social spread of COVID. The government hasn't formally reintroduced shielding, but it has given very strong advice to people who shielded last time to take extra care and stay at home as much as they possibly can. However, we do recognise the significant impact this has on loneliness and people feeling cut off from society. So it's really important that this group do their best to stay in touch with others wherever possible virtually. So sort of using social media and other ways. In terms of testing, we are very much pushing that anybody who thinks that they might have COVID, it's really important that they get tested. We did a lot of work to increase our testing rates a few weeks ago, but they have plateaued. But we would like to encourage everybody, if they have got any of the symptoms of COVID, so a new continuous cough, a temperature, or a loss of the sense of taste or smell, to book a test as soon as possible. We've got a number of testing sites across Birmingham. 9 of the walk-in, and we've got access to 2 drive-in test sites. There are slight differences in terms of in the drive-through ones, the staff there actually do the test for you. At the walk-in ones, you need to do it yourself, but they will tell you how to do it. Either site needs to be booked. I think sort of walk-in, it perhaps suggests that it's not needed, but any of the sites you do need to book your test in advance. And I was checking, your closest testing site is the walk-in one on Alfred Road. We are working closely with the government to try and increase further the number of testing sites in Birmingham, but we are relatively well served and there are plenty of appointments available. So certainly a message that it was really helpful to get out there is that getting a test shouldn't be an issue. People get the results back. The government are trying to increase the speed at which the results come back, and usually within a day or 2. But if anybody has COVID, if anybody thinks they might have COVID because of the symptoms, say the really important thing to do is to get tested and stay at home. Don't go out if you think you've got COVID. The other tests that are available, just to let you know, there is a lot of talk in the media about antibody tests. So these are blood tests to see if you've actually had COVID. At the moment, they're available for those employed by the NHS and social care, but it's really in a research capacity so that we can see how many people have had COVID. It actually doesn't tell you if you are immune or whether you could get it again. So it really is only from a research point of view. It is possible to book to order an antibody test privately, but I think they're about £150, and we certainly aren't recommending that anybody does this because, as I say, other than telling you that you've had COVID, it doesn't tell you that you're not going to get it again. There's also a lot of talk in the media about these new tests that are out there. The work on testing is developing all the time. So what we use at the moment, if you go to a testing centre, it's called a PCR test, and it has to be sent away to a lab and go through a whole process. There is a much more rapid test using this the same sort of approach, but with a different system, which gives the results within about 90 minutes. So that is being rolled out. And then there's also what are called lateral flow tests, where you spit, a bit like doing a pregnancy test, spit on a stick and get the result in a few minutes. We're looking at how we can best use these in Birmingham. This is very much at the pilot stage. It's not just as simple as spit on a stick, in that it still needs a trained technician to then do the rest of the test. But when it's done, you get the results in less than half an hour. So we think this is going to be really useful for where we need to test in high volumes, for example, the front door of the hospital, university students, that sort of thing. And we're also looking at how else we can use this approach in our communities so that we can identify people with COVID at the earliest opportunity so that they can start self-isolating and reduce them spreading it. In terms of COVID, we know that it produces in many people a mild illness, but in some people they do become really ill. And so one of the important things is to flag up how people can reduce their risk of being very ill. And these are steps that people can take now so that over the rest of the winter, if they catch COVID, their chances of recovery from it should be better. Now, I know Justin talks very much about 3 things you can't change and 3 things you can. So in terms of 3 things that you can't change, what will increase your chance of becoming very ill are your age. So we know older people are much more likely to become very ill, being male, and also ethnicity. So people from ethnic groups aren't white have got a greater chance of becoming quite ill. In terms of the things that you can change, this is what we'd really like people to focus on. First of all, stopping smoking. We know it is really difficult for people who smoke. It is really difficult to stop, and on average can take around 11 attempts to stop smoking. But stopping smoking is one way of reducing the risk of becoming really ill from COVID, as well as a whole host of other diseases. And we'd like to just flag that stop smoking services and support is still available during COVID. It's done in a slightly different way in that it's remote, but the support is still available. And for anybody who wants to stop, this is a really good time to do it. Another thing that we know really does increase the risk of being quite ill with COVID is being obese. And we're highlighting to people that having a healthier diet and doing some regular exercise to make small changes to their weight can help to reduce the risk of becoming ill from COVID. So this again is something that we're promoting, and I think it's about focusing on those small changes and just making small differences each day to improving healthy eating and doing more exercise. And then finally, the other risk factor for being ill from COVID is people who've already got chronic diseases. So, for example, diabetes or heart disease. So we're definitely promoting that anybody with a chronic disease should make sure that they're up to date with their appointments with their GP. If they've got any concerns at all about the control of their disease, then it's really worth talking to your GP to see what can be done, because if you get better control of it, then you've got more chance of not having such a bad illness with COVID. If I could just flag, the public health team in the councils worked with quite a few people to develop a Be Healthy resource, which is a series of practical resources which will help people like yourselves, leaders and professionals across the city, to support communities to reduce their risk of becoming seriously ill from COVID. And there's a whole series of resources and webinars on there. So there's information on how to stop the spread of COVID, how to improve long-term conditions, how to have healthy living, stop unhealthy habits, improve mental health, a whole series of webinars. So these are really worth flagging for yourselves and for others. And you can sign up on there to a pledge to become a sort of healthier, happier, stronger you. And there's a checklist which is available in multiple languages, and a weekly getting ready plan. So a really useful set of resources. Just briefly about vaccines. Again, another thing there's a lot of news on. I saw today coming up about one of the American vaccines, which appears to be really effective. The development of vaccine normally takes 2 to 3 years. We're obviously trying to do this at pace. When you're looking at vaccine development, you need to look at whether does it work in the lab, does it work in humans, does it work in different humans, what's the dosing schedule, is it safe, how long does it work for, do we need to give multiple doses? So there's a whole lot of research that needs to go into vaccines, and the sort of regulation to make sure that they're safe. The NHS is working really hard behind the scenes on rolling out vaccination of the population, starting with the highest risk first, and we're hoping that we're going to be starting before Christmas. As long as the current vaccines that we've got actually get over the final hurdles, then hopefully we will be starting the vaccination in the next few weeks. But I should flag it's going to take months for us to vaccinate the population, but hopefully this will be the light at the end of the tunnel for us. In terms of what we can do to reduce COVID, just to flag that everything we do, all of the decisions that we make can help to reduce the spread. The message is fairly simple in that, you know, the hands, face, space message. And I think because COVID's been around for a while, it's easy to just sort of get fed up with the sort of day-to-day stuff. But washing your hands regularly is still one of the most important ways of stopping the spread of COVID. Wearing a face covering in all of the recommended situations can also help stop the spread. And space, the 2-metre social distancing, really, really important because it just reduces the chance of those droplets flying through the air and you picking anything up. So the hands, face, space is a really important message, and we're relying on everybody. If everybody can do their bit, then this will help us to reduce the levels of COVID. There's also the Test and Trace app. And we're encouraging people to download this because this will help them to identify if they've been a contact of somebody with COVID and therefore should self-isolate. And then, as I've already said, anybody who has symptoms, get tested, and if you've got COVID or you're identified as a contact, complete the self-isolation period. Really important for this. Just to finish off, just to let you know of a couple of other things that are going on in Birmingham. We have our COVID community champions. At the start of this week, I think we had about 428 people signed up to this, which is brilliant. If you're not already, please sign up. You get the latest information about COVID directly from us, and then you can share this with anybody in your community however you want. And it's very much two-way, so we try and give you the information, but then you also let us know what is and isn't working so that we can then build on that. The government is rolling out COVID marshals, which will be a sort of visible way of encouraging compliance in our communities. So working with individuals and businesses, handing out masks, just encouraging people to be COVID safe. It's not enforcement, it's very much about encouraging compliance. And then one of the other things we have is the whistleblowing helpline, where anybody can flag any issues they see where they think a situation isn't COVID safe by reporting it online. We've had over 2,000 reports, and all of these are dealt with by our environmental health team, who pass them on to the relevant individuals. So if I can just sort of summarise, we all need to carry on doing our bit. The hands, face, space guidance is crucial. We know this is a long haul. It feels like we've been doing this forever, but it really is so important. And it's all those little bits. If everybody keeps on doing the little bits, it will make a difference. Now, I did notice there were a couple of comments popped up in the chat. Do you want me to have a look at those first? And then any questions?
Yeah, there's 2 so far in the chat. Do you want me to read it out, or? Oh
yes, there was the hyperlink. Now I remember when that popped up and I thought, oh yes, I must do that. What was that the hyperlink for?
Oh, the hyperlink is for Sergeant's report, not us.
Oh, okay.
That's fine.
Okay. So I don't think there's anything specific there. Has anybody got any questions or any comments? Actually, I'm really interested in feedback from yourselves on anything you're picking up from your communities.
Rachel, this is Kate. Sorry, there's a couple of questions. There's one about an issue that happened at the appointment centre in Alfred Road. There's another question about the death toll at the moment compared to the normal death toll at the same time last year. And then there's another one about what is COVID champion sign up.
Okay, I'm sorry, I can't see these.
Can't see these live questions.
I think you're looking at the internal questions. If you click to the live Q&A, you'll see the questions come up in front of you.
The question box, they're in there.
Okay. And it's not letting me scroll down. Oh, there we go.
I think the first question was the person who actually made an appointment at the centre at Alfred Street to deal with their 2 children. They didn't feel that they had a good service when they went there. They made an appointment for 1 child. The other child was a walk-in, but they failed to recognise that child was a walk-in. And I think what they're trying to say is that they've got mixed up when they took the swabs for the 2 children. They don't know which one is which child because you couldn't label it.
Oh, okay.
And there's no pens provided. So, and I've got several similar questions have already popped up when they've been to the centre anyway. When you go in as a family of 4 or a family of 6, the tests, there's no pen, so you don't know whose is who, and you can't remember whose is who. So when you drop it, once you've done the whole process and pop it in the box at the end, they don't know whose is who test. I think that's what they're trying to imply, because this is something similar. A question I've already got. So that's that first question. Do you want to take them one by one, or do you want to go?
Shall I sort of pick up on that one? Thank you. And I'm sorry, I actually can't see these, but never mind. If you don't mind reading them out, that'd be really helpful.
Yeah, that's fine.
So in terms of the testing sites, as I say, they are all by appointment only. So I'm very sorry that the person who has commented here didn't have a very good experience, and I will feed that back. And I think in this situation, if they've got 1 appointment and there's another child there, that's obviously where some of the confusion has come. But I will take that back, and I will also raise with them this issue of mix-up of the swabs. I can understand why there are no pens, because there's obviously a risk of spreading infection if everybody starts picking up the same pen, and that could be quite an issue. But I will see whether there's anything else they can do in terms of the system to try and help prevent that mix-up with swabs. That's really useful feedback. So I've made a note of that one.
Okay, the second question is, what is the death toll cases due to this or last month due to COVID compared to the normal death toll same time last year? I'm not sure if you can have these figures on you.
I don't have these figures on me, and certainly I don't have them for Birmingham. We know nationally, across COVID, obviously the death rates have been higher, but I can't give you specifically for Birmingham at the moment.
Okay, the next question is, what is a COVID champion sign up?
Oh, now then, that one I would be able to give you. Can I find that and post it in the chat? It should be. In fact, if you're all right, if just let me Google, because there is a link. It's probably the quickest way is for me to find it this way. Right, let's see if this will it work if I try and paste something in.
You can try, because I'm going to try in a bit.
Do I make an announcement? Is that how it works?
Hold on. You put it in.
Yeah, you can put it in the make an announcement box and it should come up then.
Okay. Except it's not letting me copy the link. No, it won't let me paste. That's all right.
If we can't, do you want to just send the link to Kay, and Kay will just email it out to everybody?
Absolutely. If I'll just put it in the meeting chat. Can you see that, Kay? But that would be great if we can get that information out.
I can't see that, I'm afraid, but if you just want to email it to me tomorrow, I'll email it out to my mailing list and then everybody will get it.
I will do that. Thank you.
Thanks.
Okay, next question is, why aren't there any outlets giving out free masks and giving out exemption lanyards to people with underlying health issues?
So sorry, outlets giving out free masks or?
Free masks and giving out exemption lanyards to people with underlying health issues.
So in terms of the free masks, whilst the situation with access to PPE and masks is much better than it was early on in the COVID pandemic, the PPE that's available in terms of the mask is obviously prioritised for our health and social care staff and settings. So that's in terms of the use of it. For the general public, then reusable face masks are what's recommended. And these you can make yourself at home. There's quite a lot online about how to make one. From a scarf or a shirt or a t-shirt. So these are relatively easy to make and they can be washed and reused. And this means that we've got the resources in terms of the PPE, the personal protective equipment and the face masks for our NHS and social care services where we really need that higher grade of equipment to be available. In terms of the exemption lanyards, I am not sure where this is up to. I've certainly seen a couple of conversations around this and I don't know. So can I take that one away and ask if anybody else has got any more information on it?
Yeah, I will feed that to all of us.
Yeah, I'll see if anybody else has come back with anything on that one as well.
I think this is just more of a statement. Somebody's thought they've been to the test centre as a family, there's no labels or pens provided.
Okay, so that seems a similar one to the first one, doesn't it? Yeah.
Explain what a COVID champion is, but I think Ted's put a link up on COVID champion, so if you all want to just look at that link. And I think that's it for Rachel. I don't think there's any more questions on here.
Can I ask a couple?
Yes, sir. So
Yeah. Thanks for that, Rachel. One issue that I've got is the COVID testing centre is on Alfred Road, but for some reason the emails that are coming out are saying it's Alfred Street. Now I did raise that, but I was told by the cabinet member that they'll rectify it, but the last time I looked it was still Alfred Street. And the question I need to ask you is, that I've been asked by residents, is why is it that airports are not accepting NHS tests, COVID tests?
So in terms of your first query about COVID testing centre, I will raise that again because absolutely it should say Alfred Road. In terms of the, have we got any further information in terms of the airports and what they are and aren't accepting?
I do, yeah, because I've had people turn back from the airport saying we do not accept NHS certificates. You have to go and pay £150 for a test, and we only accept them.
Okay, I'm afraid that isn't one that I know a lot about. I can find out if our testing expert has got any information on it.
Because as you can imagine, I mean, I've had one household basically in my ward go to Pakistan because in an emergency, and there's 4 of them. So they had to basically pay £600 on top of their ticket for the test. And to cap it off, they said they had someone else who was linked to the same family but came from somewhere else, and they had an NHS certificate and they accepted it.
Okay.
And I've had quite a few cases where people have been sent back from the airport saying that, you know, we don't accept NHS certificates, you need to get the paid one.
I honestly, I don't know, but I will see if I can find what the situation should be. I don't know how much sort of say we have over how the airports do this anyway, but I will see if I can find out any information about it that would certainly help your residents.
To be honest with you, Rachel, I think what people are, you know, finding hard to accept is that if you pay, which is for a test, which is £150, which is the same test, that's acceptable. But NHS test, which is exactly the same, isn't acceptable.
I can understand the frustration with that, so I'll see what I can find out. I know when I talked about the lateral flow tests and these, so sort of basically on the spot testing, that is something they're looking to explore within the airport, so they can do it there and then. But I'm not sure what the situation is at the moment.
Okay, thanks for that.
Rachel, we've got one more question that's popped up. Are exemptions lanyards on eBay recognised as official merchandise?
I'm afraid I've got no idea. I'm sorry, I can't help you with that one.
Right, okay. Thank you, Rachel. I think there's no more questions. So thank you, Rachel. And if we've got any more questions, we will let you know.
That's great. Thank you. I will see if I can feed all of these back. Kay, is it all right if I come back to you?
Yes, please do. Yeah, send it to me and I'll send it out.
Lovely. Thank you all very much.
Right. Thank you.
Thank you. Bye-bye.
We've got his waste management update. Les Williams. Les.
Good evening, councillors. Oh, can you see me face? I look a bit dark there.
Yeah, you look a bit dark.
Don't worry, Les, they won't recognise you.
Apologies for that. Let me just turn a light on. Let's see.
That's better.
There's no picture.
That's still no better, is it?
It's better than before.
It's a bit better than before.
Sorry about this. And firstly, apologies for lateness. I've been having so much issues with my teams today. It's yes, been challenging, shall we say. Thanks for the invite to come again this evening. Hope everybody's well and keeping safe. Just an update on waste management and where we are. With reference to missed collections, obviously, as we know, we've been able to put a service out since the start of the pandemic. And I'm quite glad to say that Sparkbrook Balsall is performing quite well with reference to missed collections. They're quite low on the tables compared to some of the other wards. I've had a brief look at our performance report. We're probably on a par with places like Sutton Trinity, Frankley, and Castle Vale. So we're doing really well on missed collections. This new second lockdown, it hasn't affected us in any way other than we have had a few more people go off with COVID, but we've got a bit of slack in our systems. That's allowing us to continue to run the refuse collection service as normal, and we don't expect that to change at all. With the street cleansing service, obviously that's took a bit more of a hit because they have been used occasionally to support refuse collection to keep that service running at all times. But what we are noticing that the dumping across the city, well, I should have said the dumping across the country actually has gone up. Birmingham's starting to see it tail off now and it's coming back down. But I can't compare Sparkbrook and Balsall to any other ward because unfortunately you are the worst currently. And I don't say that with any pleasure, obviously. What we have done locally at the depot at Redfern Road, we've took on some extra resource. So we've got an extra couple of crews out working within our worst wards, and I'll use your ward as one of them as an example. And they're out now on a daily basis and they're tackling the dumping and the fly tipping, etc. and they're also giving a bit of a hand to the ones that are not normal, where we get some extra bags put out, and that will start to see a turnaround. We've only just started them, but they are running now as we speak. So, you know, we will see a significant improvement in that. Our garden waste collection service, should anybody use that, the last collection date for that is the 6th of December. So the week prior to that will be your last week if it's at your week for collection. But the 6th of December, we will stop garden waste collections, and we're going to use them crews to back up the refuse collection service over the Christmas period, where we get a lot more waste presented. But I have to advise that with lots of people working at home, we are having a hell of a lot more waste being presented on a daily basis. So it is a challenge. But Redfern Road, when we look at our tables and scoring, Redfern Road is probably about the best performing depot at the moment for miscollections and drop waste, etc. So it is really positive for what they're doing. This year, we also got some money put into our system for leaf fall and leaf clearing. So about 3 weeks ago now, I think Redfern went live 2 weeks ago, we started some extra crews on, and they will work through the leaf clearing period, which we haven't had for a few years. And they will be obviously triaging the worst roads. We know that where you got broadleaves like conker trees, you know, that type of big leaf tree, they generally drop first. But we've had a big issue this year because probably a month ago now, the weather changed and virtually every tree dropped its leaves. That is presenting a challenge for us. But I can assure you we're working as hard as possible to get the worst roads picked up. But councillors, if you do have any screamers, obviously, drop me a note on that, and then we'll put them on the triage list to be picked up. When Christmas ends, or just after Christmas, should I say, the 28th of December, them leafing crews, we're gonna move them onto refuse collection. So I'll pick up some of the extra waste. Excuse me, sorry. To pick up some of the extra waste, and that'll be done through the preceding week after Christmas and probably into the New Year week. So, you know, we want to get all the collections back up to date as quickly as possible. We have had some bad years in the past which took us until March. Last year, it was mid to late January. We're trying to beat that this year. We're trying to get all roads having their regular collections back on track by mid-January. It's a big ask for our crews, but they're up for the challenge, should we say. Other than that, I've got no other updates. Things are really quiet, and I'm tempting fate by saying that, obviously. Things are really, if anyone's got any questions, I'm more than happy to help and give some answers. I'm just looking on the online chat.
There are a couple of questions. One's popped up from Guy. Reference to fly tipping. Do you monitor hotspots? And if so, do you liaise with other agencies, department with regards targeting and reducing the issue by landscaping, lightning enforcement, etc.? Yeah,
so for landscaping in areas like that, I can probably advise that street cleansing, refuse collection and parks are amalgamating into one unit. So we're going to be called street scene and collections. So street cleansing and the parks department are going to work a lot closer in hand, and they're going to be part of the same department. As I've probably advised in previous meetings, our refuse collectors, they use a mobile device where they can report fly tipping and excess waste and that, and they can help people if they need a bigger bin, or they're having problems with recycling, or even new bins, wherever it might be. You know, please feel free to talk to them. They're there to help. But with our fly tipping and that, again, as I said, it's gone up by a significant degree to what it would be on any normal year. It's not Birmingham; the whole country's the same, and we're probably attributing that to people being locked down throughout the year and having clear outs in the garages and all sorts. And again, the waste sites where you can take your waste, it's early days it was a bit problematic because they closed them. They are open now, but you need to ring up and book an appointment, and that's just done by the normal call centre number. And it's easy, you know, you don't have to wait in the queue. You turn up at site at the given time, they let you straight in. dump your waste or tip your waste, and then you get back out. And then if you got more, then you can ring up and book another one. So that's still running. Our bulky waste service is still running, and we've actually enhanced that as well to try and tackle the dumping. And the way we've done that is we previous to COVID, we had 2 crews, one working north of the city, one working south, and between them they picked up the middle bit. One of the steps we did take with COVID, because the amount of dumping that was coming out, we took on a 3rd crew, and that 3rd crew works on Redfern, and we've increased their workload recently as well, so they're actually able to do more. So if you got an old settee, or you and your neighbour have got one each, you can make one call and get them both picked up with the one call. It's up to 10 items, so it could be 10 settees or 10 wardrobes, or it can be 30 black bags. So, you know, please share the service with each other, because you pay the price for whether it's 1 item or 10, but they have to be in one location, obviously. So that's there for anybody should they need it, if they want to share a collection service. But we're just about to go into, and again, COVID has stopped us. We're looking to bring our own unit of waste prevention or waste enforcement on. COVID has stopped us doing it, but we are looking forward to that in the future, where we'll have an agency that are part of part of street scene that'll be able to do that for us. Hopefully that answers your question, Karen.
Thanks. Yeah, I'm just going down the list. There's quite a few questions. Text put up, how do we report access leaves?
I'm sorry, I didn't get that, Councillor.
How do we report excessive leaves?
So excessive leaves, obviously the way to report it, there's 2 ways. One is you ring the contact centre, which is 303 1112, the normal contact line. Or the easier and the alternative is do it online. And lots of people can't do it online, but it is pretty simple. You go onto any search engine, go to Google anything, and put in birmingcitycouncil.gov.uk/waste. Just put waste in at the end, and that'll take you to where you need to. And that way you can book collections, you can report problems, and it's done online. So as soon as you click send on that, it's gone. You're not waiting for someone to answer the phone and to get the wrong information. It goes straight away that way. I find, although I don't report much, that is a far easier system. You can do it on your smartphone, on your tablet, on your PC. But if you haven't got the technology, obviously the phone is always there, 303 1112, and that takes the it's a not face to face. It's a person you talk to.
Right, Fix My Street. That's not ours, is it? We don't normally promote Fix My Street, do we?
So I think Fix My Street is if we've got problems with infrastructure, you've got broken lampposts or bollards knocked over, or there's a bench on there that needs repairing. I think it does tick into us a little bit, but I would have to go back and come back to you.
Because I think I did ask this question last time, and I'm sure it's it gets to us eventually, but there's a couple of houses that it sort of wanders around the emails by the time it actually gets to us. So I think the easiest and the quickest way is just to report it online or ring the contact centre. Somebody's wrote here, we are slacking with street cleaning. We have light tip in almost every corner, special black bags. What's happening with leaves being picked up in other areas like Hall Green, Yardley have been collected, but Sparkbrook again has been neglected again. Also, bin men leaving rubbish behind. What's falling out of the lorry and not being swept up. And yeah, that was raised. I think I did copy you that one in, so you've got a heads up for today.
Yeah. Unfortunately, I haven't picked that one up. I have to say, it's disappointing that if a crew are dropping waste, that they're leaving it. I will take that.
Not the first time they've done this. I've received several emails over the weeks about bin men leaving a trail of rubbish behind.
Yeah, well, I will say, Kaz, that's disappointing. I will take that back to the depot. Our vehicles now, if it's on a wheel bin and lifted that way, because the eye to the back, it shouldn't drop waste. So I'm going to assume that it's the black bag collection vehicles, which are traditional dust carts as we would understand them before wheel bins. I will take that back and make sure that it's their duty to clean up any spillage or drop waste at the back. I'll make sure that they start doing that. But again, if you do get any instances of that, please let me know, because I will tackle the crews about that.
Okay, and same in that question was about the leaves picked up. I mean, Hall Green and Leafy Moseley is leaf-free at the moment, and Sparkbrook is covered in leaves. Why is that?
What road, sorry? I've got Moseley, and I just...
They said that, no, the question was Leafy Moseley is leaf-free now from all the leaves that have been dropped, and yet Sparkbrook is still knee-high in leaves.
Without driving around Sparkbrook, obviously I'd struggle to answer that. Moseley is quite
What I
loose.
will do is I'll email you a list of roads and I'll let you know that one.
Please do. I'll get them triaged. Obviously, Moseley is very loose. He has some other areas of Birmingham. Traditionally, we would go to them first. This year has been a strange year where, as I said about a month ago, the weather changed and everything dropped the leaves in one go. And we usually get a season of about 3 or 4, maybe 5 weeks where the dry leaves. We haven't even had that. They've just dropped and stopped there. It's been a real challenge for us. But if you can tell me the roads where you got issues, I'll make sure that gets to the depot and triage them.
Okay, yep. The other question is, why are there less road sweepers in the ward compared to other? BCC should be sending out the same efforts to all areas, not penalise certain wards with cutbacks.
Yeah, all wards have got a designated resource of sweepers, and that's both large and small. Sparkbrook and Balsall are, I would have to check. I think you've got 1.5, which sounds strange, but across the week you'll have someone full time and someone that comes in there for a couple of days to help back that up. Your large mechanical sweeping, it usually runs on about a 2 to 3 week rota, but with the leaves, that obviously puts the rotas back quite a large way in all the different functions we do, because we concentrate on getting them up, obviously. But if you need to, if you want me to identify exactly what you've got, I'm quite happy to do so.
Yeah, that will be good, and we'll share it with everyone. Is there going to be a leaflet telling people what to put in recycling bins?
I would say that yes, we're doing a bit of an exercise, because, and I think we should do this as a city council anyway from time to time. Lots of people, we've got new people come to live in Birmingham, and they, in different parts of the country or even in Europe, they recycle differently to us. What we're going to be doing in the very near future, and we discussed this only last week, is how can we get that message out better? And we were talking about stickers on bins and stuff like that, but it's still in a discussion stage. But you know, clearly we want everyone to recycle, because it saves the city money on tipping and burning, and recycling is really good. We don't meet the needs. We don't meet the performance indicators as a city that we want to get to. So you know, we are in the new year. We'll be working very hard, and obviously, perhaps one of our next meetings, I'll be coming to do a presentation just on that subject.
That's fine. There's just so many questions. Guys, what you've not monitored, except as the question getting not answered. I can't remember what the question was.
I'm sorry.
Sorry, there's, I think it's a reference fly tipping. The question
Right.
was, do you monitor hotspots? And if so, do you liaise with other agencies, departments with regard targeting and reducing the issues by landscape? You've answered the landscaping bit, but not in regarding the litter and fly tipping. Do you monitor it? And do we have a sort of a report generated to that?
Yeah, apologies for that. Yes, I did miss that out. It wasn't on purpose. Yes, we do. Where we got regular fly tipping spots, we do manage and monitor them. Some of the issues we do face is if someone dumps a settee or an old cupboard, we've got no way of finding out who's dumped that, and it does create challenges. If people dump black bags, we do take evidence from them. And we're finding, you know, sometimes it's shops, it's not residents. People bring it, and they're not bringing it from where they live either. So we do manage that, and we share that information with our waste enforcement team. But as I've suggested a short while ago, we're bringing our own waste enforcement team in, because the waste enforcement team themselves are busy doing lots of enforcement type of jobs across the city, and we've seen a bit of a gap in our ability, so we'll bring in somebody in, but we do share it with them, and we ask them to take action, and they do. I recently asked them for a list of people that have been prosecuted or people that have been fined. As we speak, we're waiting for them to generate that, because we didn't really have another quite large one where a company with fly tipping will find a large amount of money for doing so. So yes, you know, we do welcome if you see someone doing it, please tell us. And even more, the next step, if you're willing to put it into a statement for us, I promise you we'll take that person to everywhere we need to go to get them to pay for what they've done. But you know, the residents of the eyes and ears on the streets, obviously we can't be there 24/7. But if you do see it, please tell us, and we'll do what we can to sort it.
One of them is, can we get stickers to put on bins when the bin day residents still putting bins out on the wrong day?
Oh, we did that a while ago, didn't we, down in Balsall, where we put it on lampposts, didn't we? Where we told people what the bin day was. I think it's something, yes, we can look into that, because as we've discussed, there's lots of people come and live to the local area, and if one person does it, it throws confusion out to everybody else, if that makes sense. So it would be good to do some communication, and I think the communication is going to be what days your bin collection day, what you cannot put in or can and cannot, and also what the recycling is, because that's an alternate day, obviously, every 2 weeks. I think we need to get some information out to all the residents. And I want to take that back, because we're looking at that as we speak. Just making a note.
Ted put up Birchwood present because of Balsall Heath Park for leaves. I've made a note of that as well. I'll add it onto the list of other roads. If anyone's got in the list of roads that they want their road cleaning, can they either just email me or let me know which roads they want clearing? But I will be doing a spot check on some of the roads which leaves haven't been picked up. Are there any more questions for Les since we've got him here? Or have I missed any questions off? There are quite a few messages in the chat. Looking to see if there's anything.
Councillor saying it's Kay. There's another one come through with a list of roads: Osborne, Medlicott, Walford, Benton, Madeley roads are all covered in leaves and are very dangerous.
Right, I'll email Les anyway with these.
If you could do, Council, I mean, I'm picking bits up. I've got Birchwood Crescent, and it mentions it's slippery from Ted Ryan, so I'll pick that one up, Ted. Obviously, I'll add that to the list, and I'll have a chat with the depot to get one of our leafing crews get down into Sparkbrook, give it a good clear up. Benton, Madeley, and all that, they are all broadleaf trees. They're all chestnut trees. We should be out there. That's one of the roads we should go out first in that area. So once we get out there and have a good clear up, we can then get back to our normal duties of litter picking and sweeping.
Brilliant. Thank you, Les. And if we've got any more questions, we will let you know. So
yes, please do. And please, your next online meeting, invite me, and hopefully I won't have such an issue with my teams.
Brilliant. Thank you.
Okay, thank you, councillors. Good evening. See you soon.
Thank you. Thanks. Goodbye.
Bye now.
Thanks. Next item is item 5, which is the police update. The police are here. They are listening. They have wrote in the chat. I'm not sure if you can all see this. We have got a bit of a link that's been put up John, can you just scroll up and down, or we have received the report.
Then you're going to have to share with me, Kay.
I'm going to see if I can copy and paste this onto the group.
Oh, hang on, John.
Well, I've copied and pasted it into the chat. If you are looking questions and answers the chat, this is the report that Chris has sent. It's a fairly detailed, long report that he sent of all the lovely things and all the hard work that they have been doing in the ward. Don't really fancy reading all this out. If you just want to scroll down and have a quick read, we are having a bit of a tech issues.
I don't think the whole of the report's been pasted.
Has it not? Let me see.
I think we've got a bit of an issue with it, Councillor Hussain, because I keep putting it into the live box, but it keeps it won't go live for some reason. I can't get it to sit in the live box and go live.
Oh no, I haven't got all of it either. The team have been, and then that's about it. Let me see if I can. I don't think I'll paste all of it.
Okay, send me live.
You need to put your camera on, John.
No, I don't. I'm doing it from the chair. Just send me live.
Okay. It won't go.
Ah, okay. Let's try it with the camera.
Sorry, folks. We seem to be having a bit of a
try again.
Difficulty with that.
I am trying to put some stuff up in the chat. Can you all see that?
John, you're live now.
Thank you, Kay. See if we can make this work, guys. No, sorry, guys, it's not going to work.
Right, shall I just read out Sergeant's report? Small.
You're back live now, Councillor Hussain.
Oh, right, sorry, I didn't know I wasn't live. Right, shall I just pick out a few key points, because it's 2 pages long, what the Sergeant has sent. So I'll just briefly just scan some of the stuff that what they have been doing. Current priorities for the team have been obviously centred with COVID enforcement during the lockdown period. In line with force policing, the team has utilised the 4 E's approach: engage, explain, encourage, enforcement. Enforcement of COVID breaches is always the last resort. They've been quite active with patrols of high footfall locations such as shops, supermarkets, telling people to wear their face coverings. Patrols have been conducted with environment services with the force of businesses which have been trading in breach of the restrictions. The team have also been out on Moseley Road with regards to face covering, together with an impact team of over 250 directions to leave notices that have been issued on a number of fines have also been issued to businesses that have been breaching. The local police team have also been engaged with Shri Prakati Hindu Temple on Samson Road with COVID secure arrangements for their Navratri festivals in October. That's when we were in Tier 2. Together with the environment services, COVID secure protocols were in place. The team would also like to thank the community for their ongoing support and cooperation in what clearly is an extremely challenging and difficult time for most of us, and these patrols being well received by the community. In addition, patrols have been teamed up with maintain a focus around additional priorities, including domestic violence and violence under 25s. There has been included arrest of a suspect of domestic abuse, as well as providing support to victims. The team have also carried out proactive operations and weapon sweep which have been resulted in recovery of knives and have assisted with joint operations with the impact team based in Sparkhill. These are successful operations working closely with the force departments have resulted in stop and search operations resulting in recovery of large quantity of drugs and arrest of those linked to drug dealing activities. Over 10 weapons have been recovered during these operations, including knives, machete, baseball bats and knuckle dusters. On top of that, a firearm and ammunition have also been recovered. The team also engaged with young people suspected of involvement of drugs, counting lines and make use of referral opportunities to partner agencies. Early November, the team have carried out proactive operations which resulted in several stolen vehicles and vehicle parts, engines involving it being recovered by a burglary suspect has also been arrested by the team, and teams of stolen property recovered. The team provided regular updates on Sparkbrook Twitter account, which documents of our activities and examples, including parking enforcement patrols, some which have been carried out jointly with civil enforcement and also at schools, parking patrols at Montgomery. Also operations focusing on fly tipping and problematic locations, including house and multiple occupations, with visits with BCC, private rented teams, and effort are also being made to progress long-term plans with regard to the current begging problem on Stratford Road, which is being supported by CCC and other partner agencies. The current crime figures today for Sparkbrook Ward shows that there has been an overall increase in total crime, with an increase of 3.24%, 2,904 offences last year compared to 2,998 this year. The main increase has been domestic violence, which has increased by 26.79%, 433 offences last year compared to 549 offences this year. It is worth noting that the additional trend and not particularly to Sparkbrook. Other increases have been in violence with injury for under 25s, which has been increased by 9.33%, 75 offences last year and 82 offences this year. Reductions have come in other areas, including robbery with 8.76, reduced to 137 offences last year and 125 offences this year. Vehicle crime has also been reduced significantly with 29.73 reductions, 407 offences last year and 286 this year. I would also like to take this opportunity. This is Sergeant speaking, Rigby. I would also like to take this opportunity to let the community know that he will be retiring from West Midlands Police in early December after 30 years with the force. It has been a privilege to have been in the neighbourhood sergeant for Sparkbrook and Balsall Heath in the recent years. It has a role I have enjoyed immensely. I have been impressed by the sense of community which comes to the force. Whatever challenges have risen and concerned and support with people show for each other, as highlighted with current events. With regards to my placement, long-term appointment to the role has not been made. In short-term, Sergeant Chris Gallen will be running the team. I hope I have made a difference, even if it's a small one, but please stay safe and best wishes for the future. That's Sergeant Rigby. So can we all, obviously we would like to wish Sergeant Rigby farewell, and we also welcome Chris Gallen. So that's the report so far. Are there any questions, which I can't really see any? Sorry, has anybody right, questions? What's the priority with police officers and local crimes compared to COVID breaches? That's one question. What we can do is we can email these questions to the Sergeant, and then when we get reply back, we will circulate them out to you. Should we just take these questions off and we'll just email them to Sergeant? Because there's a couple of questions here or some statements.
Yes, I can do that for you. I'm just I think sergeants have responded to one question about PCOs, and they've said we have a number of new students we are training, so the numbers are increasing slowly, but we're hopeful for a numbers increase. Yeah, but I can forward the responses to the sergeants and get responses back and then circulate them.
That's fine. Brilliant. So thank you to Sergeant for his time with us. It's a shame he's leaving, but we've got Chris. So thank you. We've got councillors update. We've got a couple. I've received a couple of questions before the meeting has actually started. First question was about Alchester Road, the bus lane, and just trying to look for the question. Just trying to find the answer.
Do you want me to cover that one? Yeah.
Yeah, I have seen you. Yeah, you can do that one. I'll do the next one.
Yeah, basically the question was, the update is following the consultation that concluded on the 22nd of November 2019 for the bus priority on Moseley Road and Alcester Road scheme and further stakeholder engagement in early 2020, a full business case was prepared for approval to proceed with the scheme at the request of the Cabinet Member for Transport and Environment. A review of the scheme was initiated due to the COVID-19 pandemic. This review by the technical consultants was completed in October. TFWM and the Council are currently going through the review outputs with the technical consultants, whilst also liaising with the Council planning team to ensure the review aligns with the both of these town square proposals, the feasibility of which is currently being explored. In connection with the delivery of the neighbourhood plan, the review focused on the reduced available widths for pedestrians, both during construction and the scheme final form. It is hoped that the review will be completed this year when a further update on the scheme can be shared. I've already raised with the TFWM that it seems to be a no-brainer that everywhere else we're shortening the road, but here we're trying to widen it, so that has been taken on board, and this is the response we got. So I'm waiting for a further response, and it will be reported. Thanks.
Yeah. Just to add on to that, Danny has actually been replaced by Edmund Salt, who is now in charge. So there's no Danny. So just to point that out. The other question was about Ladypool Road, the one-way restrictions. A decision. I've received an email to say that a decision has been made to make Ladypool Road permanent, as long with physical segregating country ball cycle lanes to prevent vehicles blocking it. Segregations will either be with wands, as shown in the picture below. But I have received this email, so what I can do is I can either give it to Kay, and Kay can email it to everyone who wants to know. There's that, and there's one more thing I want to, well, either discuss with everybody. Is about Ladypool Road again. The temporary measures that have been placed because of COVID. I'm sure you're all aware that we've put some barriers up to maintain social distancing. So I have received an email, and there are 5 suggestions on this email about which is the way forward. One is there's advantages and disadvantages. So I will just read it out to you. I'll get Kate to email you all. So I would appreciate if you all just came back and gave me what options you all agree on. There's 5 options. Option 1 is to remove the whole entire restrictions from Ladypool Road. The advantages for that would be it's saving costs, and it likely will be popular with the local businesses. The disadvantages for that would be it'll be lack of social distancing. And then there's another one, which is the other option is remove partially reinstate parking to those footwear with lower footfall. And the advantages for that is partially saving ongoing costs, and you can still be able to maintain social distancing. The disadvantages for that will be lack of social distancing in some areas, and drivers will continue to move the barriers. Still need to maintain. So a couple of the suggestions. Reading, if you can all respond back which suggestion you would prefer, or if you have your own suggestion, that would be great. So they are the three things that what we really wanted to discuss. If there's any other questions, which is please put them in chat. Ted's put something up. Well, will the community be consulted on Balsall Heath Town Square plan, e.g. what square town square plan? This is something about Balsall Heath. So how do you want to add on a bit onto that one?
Yeah.
Heath.
Oh, well, yeah, basically, Ted, I think you probably know more than I do anyway, because you're part of that, the group. But as far as the square plan is concerned, unfortunately, there was a meeting last week, which I couldn't attend because of ill health. But I've had an email saying that they wish to meet me to discuss exactly what the town square plan is going to look like. So as soon as I find out, I will basically send an email out telling everybody what they're trying to do. But the small snippets that I've had it's linked to the I think it was the Balsall Heath plan that was put in 2000, either 12 or 14. So powers that be are trying to push that, and basically it's without getting the full information, but I'm assuming it's all linked to the parish council that they're trying to push for. But yes, the consultation will happen. You know, that's one of the things I will insist on, that, you know, there will be a full consultation once I've been briefed of what this town square plan entails. Okay, Jim.
Right. Thank you. I'm just briefly looking down if there's any other questions. Don't think I've missed any questions off. Somebody's got option one, remove the barriers, but then there's you're not maintaining social distancing, and obviously you've heard the COVID report. But yeah, I will take whatever the majority is going to be. So what I will do is I'll get Kay to send out the police report, and I'll get Kay to send out the options, and then if I would appreciate if everybody did reply back with whatever options they agree with, and if they've got their own suggestions, that would be great. But if there is no more further questions, that's it from you, unless you want to add or say something.
Yeah, I mean, in Balsall Heath, there seem to be quite a few hotspots. One is Hayden Works, the other one is behind Lidl on Moseley Road, and then there's Speedwell Road by the park, where there's always gatherings in the night. And the other concern is, I know it's a concern everywhere where cars are speeding, but Court Road, there's been so many near misses. So I have asked the engineers to have another look at Hayden Works and Court Road, if we can do anything in making it safer, or basically get it, you know, resolve the issues. I know the issues won't be resolved because these issues are Birmingham wide, or should I say countrywide, but anything that can help we'll be grateful. So I've asked for a report and see if we can actually do something to aid these areas. But there's another issue where on the corner of Adams Street and Edward Road, it's always been a hotspot for accidents, and in the last 2 weeks there's been 2 massive accidents, which they need to be addressed. But apart from that, the normal ongoing litter, double parking issues are continuing.
Right.
Okay.
Thank you, Zahar. Right, I can't see any more questions in the chat. So for now, I would say thank you ever so much for attending, and we will be in touch when the next board tasking meeting is going to be. So thank you very much, everybody, and good evening.
Thank you. Thank you for all attending.